Chapter 18 of ICD-10-CM is for signs, symptoms, and abnormal findings. This presentation will cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter R, and some common codes for this chapter include chest pain, nausea, and diarrhea. If you remember from ICD-9, these codes all started with the number 7. In ICD-9, this chapter followed the perinatal chapter. In ICD-10, it was moved to follow the congenital anomalies chapter. There are some definitions that I would like to point out so that you are choosing the most accurate ICD-10-CM code in this chapter. A symptom is something observed by the patient, such as abdominal pain or headache. A sign is something that can be observed by someone other than the patient, such as fever, which would be diagnosed after a thermometer reading. A syndrome is a set of symptoms that occur together. For example, irritable bowel syndrome consists of many symptoms that usually occur together, including abdominal pain, gas, bloating, and diarrhea. Code R29.6, repeated falls, should be used for patients who have recently fallen and the reason for the fall is being investigated. Code Z91.81, history of falling, should be used for patients who have fallen in the past and are considered to be at risk for more falls. You may end up coding both R29.6 and Z91.81 for the same encounter to show that a patient who has recently fallen is at risk for future falls. SIRS stands for Systemic Inflammatory Response Syndrome, which is category R65 of this chapter for symptoms and signs specifically associated with systemic inflammation and infection. Codes in this category are used for SIRS of non-infectious origin, with and without acute organ dysfunction, and severe sepsis with and without septic shock. The underlying condition, such as heat stroke or injury, should be coded before the SIRS code. For severe sepsis, the infection, such as Staphylococcus aureus, should be coded first. Let's do a SIRS example. This patient was admitted for treatment of SIRS due to heat stroke. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is T67.0XXA, heat stroke and sunstroke initial encounter. We learned on the previous slide that the underlying condition must be coded before the SIRS. Therefore, you would start at heat in the alphabetic index and then find stroke indented below, which points to T67.0 with a checkbox next to it indicating that more digits are required. When we confirm the code in the tabular index, we see that a 7th character is required for this code. The box at category T67 tells us that our choices are A, D, and S for the current episode of care. Since the patient is being actively treated for the condition, a 7th character of A is appropriate for initial encounter. Since our code is only 4 characters long, but a 7th character is required, 2 dummy X placeholders are needed in the 5th and 6th character positions so that the 7th character A can occupy the 7th character position. There is also an instructional note in category T67 stating, use additional code to identify any associated complications of heat stroke, such as systemic inflammatory response syndrome, subcategory R65.1. Therefore, the second code of R65.10, Systemic Inflammatory Response Syndrome, SIRS, of non-infectious origin without acute organ dysfunction can be found by either turning to this subcategory to obtain the appropriate code or by utilizing the alphabetic index. In the alphabetic index, you would start by going to syndrome, then Systemic Inflammatory Response, SIRS, of non-infectious origin without acute organ dysfunction, which points to R65.10, which you would then confirm in the tabular. There is another helpful note stating code first, underlying condition such as heat stroke. So we know that the heat stroke has to go first, followed by the SIRS code. One of the new concepts of ICD-10 is that codes for coma scales have been added. We were unable to capture the coma scale in ICD-9, but these codes will be important for trauma registries. The codes can be used in any setting, but are most applicable to the trauma registries. The coma scale codes are in subcategory R40.2, and there are 3 subcategories for whether or not the eyes are open, the patient's best verbal response, and finally, the patient's best motor response. You would need a code from each subcategory to complete the coma scale, though these codes should never be the principal diagnosis. Instead, you would code a condition such as traumatic brain injury first, followed by the coma scale. We also use 7th characters in the coma scale, but the 7th character has its own separate meaning for comas. It indicates where the coma scale was recorded, including in the ambulance, arrival at the ED, hospital admission, and finally 24 hours or more after admission. The 7th character should match for all 3 coma scale codes. The guidelines state that at a minimum, the initial coma scale score should be reported regardless of where it occurred. Subcategory R40.24 is for the Glasgow Coma Scale or total score. This is only to be used when the total score is documented, and there is no mention of the 3 individual coma scales. There are 3 Glasgow Coma Scale ranges, score of 3 to 8, score of 9 to 12, and score of 13 to 15. Let's try a coma scale example. Documentation states, eyes do not open, no verbal response with no motor response. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is R40.2110, coma scale, eyes open never, unspecified time. To locate this code, start at coma in the alphabetic index, and indented below this is the word with, followed by the 3 elements needed to complete the coma scale: motor response, opening of eyes, and verbal response. In this case, it doesn't matter the order of the 3 codes, as long as a code from each of the 3 scales is reported. I started with opening of eyes, which is none for this patient. Therefore, the code next to the phrase opening of eyes never is R40.211 with a checkbox next to it indicating that more digits are required. When we confirm our code in the tabular, the 7th character option of 0 for unspecified time is appropriate, since our documentation does not include when the coma scale was assessed. Therefore, the next 2 codes would be R40.2210 coma scale best verbal response none, unspecified time, and R40.2310, coma scale, best motor response, none, unspecified time. These codes can be located in a similar manner by starting at coma in the alphabetic index, then find verbal response, none, and opening of eyes, never, with matching seventh characters for unspecified time of assessment. And remember that if we had the injury documented or the reason the patient was in the coma, that's what you're going to be reporting first. I just wanted you to practice the coma scale. Let's try another example for this chapter. We have a diagnosis of microcalcification found on breast mammography. How would you code this? Please pause the webinar to complete this example, then hit play to continue and learn the answer. The answer is R92.0, mammographic microcalcification found on diagnostic imaging of breast. To locate this code, start at microcalcifications, breast in the alphabetic index, which points to R92.0, which you would then confirm in the tabular. For the last example, we have a patient complaining of left lower quadrant abdominal pain, along with nausea, and has vomited several times. Patient has an elevated blood pressure reading, but a diagnosis of hypertension is not made at this visit. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is R10.32, left lower quadrant pain. To locate this code, start at pain in the alphabetic index, then locate abdominal. Indented below this is the word lower, then left quadrant, which points to R10.32, which you would then confirm in the tabular. The next code is R11.2, nausea with vomiting, unspecified. To locate this code, you would start at nausea in the alphabetic index and then the phrase with vomiting, which points to R11.2, which you would then confirm in the tabular. The next code is R03.0, elevated blood pressure reading without diagnosis of hypertension. Even though documentation states that the patient's blood pressure was high, a diagnosis of hypertension was not made. Therefore, to locate this code, you would go to elevated in the alphabetic index, then look for blood pressure, then reading, no diagnosis of hypertension, which points to R03.0, which you would then confirm in the tabular. And I just want to remind you that you code for signs and symptoms when a diagnosis has not been made. So for this patient, it was appropriate to code for the abdominal pain and the nausea and vomiting because we don't have a diagnosis. But if we had a diagnosis that included those symptoms, you would only code for the diagnosis. Now it's time for our quiz. Our first question is which coma scale code or codes are assigned when only the total score is documented in the medical record and not the individual scores? The second question is when SIRS is present with a non-infectious process, which code is listed first? The final question is what code is assigned when the patient repeatedly falls while attempting to walk? You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is when only the total coma scale score is documented, a Glasgow coma scale code is assigned. To locate this code, you would go to Glasgow coma scale in the alphabetic index where there are options for the different score ranges. The answer to the second question is when SIRS is present with a non-infectious process, a code for the underlying condition is reported first, such as injury or heat stroke. The answer to the last question is when a patient repeatedly falls while attempting to walk, code R29.6 for repeated falls is reported. To locate this code, go to falling, falls with repeated in parentheses in the alphabetic index, which points to R29.6, which you would then confirm in the tabular. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 18 of ICD-10-CM, Signs, Symptoms, and Abnormal Findings. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860.